moving on to a second panel. So the second panel is called Access to and Experiences of Mental Health Services and Supports in Ireland. So we first speaker for this panel is Dr. Pádraig Ó Féich, or also known as Paddy, who's the research officer at Mental Health Reform, who is joining us now. There you are, Paddy. So if you'd like to take it away, where are you joining us from today? Oh, you need to put your mic on. Your mic, because it's. There you are! Yay!
Is it working now?
Yeah, perfect.
Can you hear me? Okay, great. God, you know, there's always one, and I knew it would be me. So I'm just going to share my screen now, and then we can get on with it. So I'm going to talk to you today about Mental Health Reform's My Voice Matters project, which was a national consultation of mental health service users and the family members, friends, carers and supporters of mental health service users, and then move on to presenting some initial findings from a project that we're carrying out in partnership with LGBT Ireland, looking specifically at the experiences of LGBTI plus mental health service users using the My Voice Banners data, but also collecting additional information through a series of focus groups which we're currently carrying out. So I'm going to start off with some background about the My Voice Matters project itself. So between 2011 and 2015, Mental Health Reform carried out a series of regional consultation meetings with mental health service users and with family members, friends, carers and supporters of service users. Now, through this process, we identified the need for a large-scale national consultation with these groups. We approached the HSE for funding and secured it under the condition that Mental Health Reform carry out the consultation independently of the HSE, but with their full support. So we carried out two surveys, again, one of service users and one of supporters of service users. Now, approximately 2,000 participants took part, around about 1,200 mental health service users, and around about 800 family members, friends, carers, and supporters of service users. So the whole project took a very collaborative and participatory approach, essentially putting those with self-experience at the very center of the work, right the way from the development of the initial research questions through to the survey design process, all the way through to the publication stage. And that's an approach that Mental Health Reform take with all of our work, again, echoing that, lived experience being very central to our work. So we published two reports as a result. On your left, you can see the service user survey report in orange, and on the right, you can see the family members, friends, carers and supporters survey report in grey on your right. So both of these reports are available from Mental Health Reform's website, mentalhealthreform.ie, or from Ireland's Health Research Repository at linus.ie. Now, there are shorter versions available, around about 20 pages, but these, if you don't feel like reading the whole report, but I would encourage anybody who's interested to check them out. So what we're doing currently in our ongoing project at the moment is using data from the My Voice Matters project to explore the views and experiences of LGBTI plus participants. Specifically, the aim of the ongoing project is to explore the views and experiences of LGBTI plus mental health service users and to compare these experiences with non-LGBTI plus mental health service users. So the project has two parts, the quantitative or statistical part, where we're looking at data from the My Voice Matters project from participants who identified as LGBTI plus community members. And then we're supplementing this or delving in more detail and more depth using a series of focus groups with LGBTI plus mental health service users. Now, we're currently recruiting for these focus groups. We have recruited a number of participants, but recruitment is ongoing and that call for participation is open. So I'd encourage anybody who's interested to bring that the project to the attention of their networks or to look for more information on Mental Health Reform's website. So what I'm going to do today is present some preliminary findings from the initial analysis of the My Voice Matters service user survey data. And I'll focus specifically on areas where there was an evident difference between the experiences of LGBTI plus participants and non-LGBTI plus participants. So who took part in the My Voice Matters project? Well, as I said, around about 1,200 or 1,188 participants who are over the age of 18 and who had experience of accessing the mental health services in Ireland in the last 2 years took part in and completed this survey. Now, a substantial proportion of these participants, around about 1 in every 5 or 19.1%, reported identified as members of the LGBT community. That gave us a sample of around about, of 215 LGBTI plus participants. This group had an average age of 33.1, ranged in age from 18 to 68, and had a gender identity ratio of 56% female, 33% male, and 11% other, including trans male, trans female, intersex, and so on. Now, what we did was we looked at these participants' responses on every item in the survey, and we also compared their responses to the responses of non-LGBTI plus participants. Now, we had 912 participants that were not members of the LGBTI plus community. This group had an average age of 40.7, range in age from 18 to 76, and had a gender identity ratio of 65% female to 35% male. Now, I'm going to start with some questions relating to primary care, first of all. And I would say that what I'm able to present here today, due to time restrictions, is going to be very limited. So there is going to be, the surveys themselves, the survey itself was nearly 60 items long. And so I've had to be very selective in terms of the findings I'm presenting here. But just to start off with some relating to primary care, as I said. Participants were asked to indicate how satisfied they were with the mental health specific treatments they'd received from the GP. Now, LGBTI plus participants reported lower levels of satisfaction with this mental health specific treatment from their GPs. And we can see that from the graph on the left-hand side. 30% of LGBTI plus participants reported low levels of satisfaction compared to just 22% of non-LGBTI plus participants. In a related item, participants were presented with the following statement and asked to indicate how much they agreed or disagreed with this statement. My GP gave me enough time to speak about my mental health difficulty and listened to what I had to say. Now, levels of agreement were significantly lower amongst LGBTI plus participants to this statement, and you can see that again from the graph. If we take the two blue sections of each bar, we can see that just over 50%, around about 55% of LGBTI plus participants agreed with this statement, whereas the figure was much closer to 70% for non-LGBTI plus participants. Now, participants who had reported accessing community mental health services in the 2 years prior to completing the survey were presented with a series of questions relating to community mental health services. In other words, only those with directly relevant experience were asked specific questions, such as this. Overall, in the last 2 years, did you feel that you were treated with respect and dignity by community mental health services? Now, the extent to which LGBTI plus participants felt that they were treated with respect and dignity was significantly lower compared to non-LGBTI plus participants. Just 30% reporting that they always felt they were treated with respect and dignity compared to 44% of non-LGBTI plus participants. At the other end of the scale, you can see that more than 1 in 4 felt that they were not treated with dignity and respect by community mental health services in the last 2 years or in the 2 years prior to completing the survey. And that figure was 18% for non-LGBTI plus participants. Participants were also asked whether they had the contact details of a designated mental health professional or a key worker on their community mental health team to provide them with support. Now, as we can see, a larger proportion of non-LGBTI plus participants reported having these contact details. In fact, LGBTI plus participants were significantly less likely to report having the contact details of a designated mental health professional, fully 1.5 times less likely to report having these contact details of a key worker. Participants were also asked whether their community mental health team took into account how their mental health difficulty affected different areas of their lives, like housing, education, employment, and so on. Now, a lower proportion of LGBTI plus participants reported that this was taken into account by their community mental health team, at least to some extent. Again, going to the graph, if we take the blue and orange sections of each bar, we can see that 46% of LGBTI plus participants felt that this was taken into account to some extent, whilst this figure was higher for non-LGBTI plus participants at around about 59%. Again, participants who had accessed psychiatry services were presented with a number of items relating to their experiences of psychiatry services. Specifically, participants who reported currently having a psychiatrist were asked the following question. Do you feel well supported and listened to by your current psychiatrist? Now, on average, the extent to which LGBTI plus participants felt that they were supported and listened to by their current psychiatrist, was lower compared to non-LGBTI plus participants. Now, although there is a difference here, this was not a significant difference. However, it did approach this statistical significance. Moving on to some questions about treatment and care now, and I'd like to start off with continuity of care. So participants were asked in the last 2 years how often they had had a change of psychiatrist. Now, LGBTI plus participants were 1.5 times more likely to report having had a change of psychiatrist in the last 2 years. All participants were asked what impact this change, if they had had a change, what impact this change had had on their treatment and care. Now, the responses of both groups in this case were quite similar, and there were no significant differences. The largest proportion of both groups reported a negative impact on their treatment and care as a result of a changing a psychiatrist. What's interesting to note here is that for both groups, there was a significant negative correlation between the frequency of change and the perceived impact of that change. In other words, the more frequently participants change a psychiatrist, the more negative the perceived impact on their treatment and care. And this highlights the importance of continuity of care in the mental health services. Participants were also asked to indicate the extent to which medication had been the main focus of their treatment and care. On average, LGBTI plus participants reported a significantly lower focus on medication as part of their treatment and care. And again, we can see this from the descriptive findings in the graph. 54% of LGBTI plus participants report a high focus on medication. This was closer to 63% for non-LGBTI plus participants. Participants were also asked whether they had been referred to talking therapy by community mental health services in the last 2 years. And the responses of groups were quite similar in this regard. Approximately 30% of participants in each group reported that they had been referred to talking therapy, and a slightly larger proportion of LGBTI plus participants reported that they hadn't been referred to talking therapy. However, there was no significant difference between the groups in this regard. Finally, in terms of treatment and care, participants were asked how likely they would be to use online supports and apps as part of their therapy if it was available. This is a particularly relevant question in the current circumstances, given the shift, the very necessary shift towards remote service provision and the provision of mental health supports remotely. So LGBTI plus participants were found to be significantly more likely to use online supports and apps as part of their therapy. And again, you can see this from the graph, with more than 62% of LGBTI plus participants reporting that they will be likely or very likely to use these kinds of supports, whilst this figure was closer to 53% for non-LGBTI plus participants. Now, the broadest indicator included on the survey was one that asked participants to rate how satisfied they were with their overall experience of HSE mental health services in the last 2 years. Now, they could do this on a scale ranging from 0 to 10, but for the purpose of illustration, to make it easier for participants to get a good feel for participants' attendees to get a good idea of participants' responses, I've categorized them as poor, which are scores between 0 and 3, neither good nor poor, scores between 4 and 6, and good overall experiences, scores between 7 and 10. Now, you can see from the graph that a lower proportion of LGBTI plus participants, 23.5%, reported good overall experience of the HSE mental health services, whilst 30% of non-LGBTI plus participants reported the same. So what can we conclude from these findings? And I have to be very, very careful here. The first thing I'd like to point out is that this project is ongoing, and it is too early to draw any conclusions with any level of confidence. What I've presented here is a selection of preliminary findings only, and for the purposes of this presentation, I've focused on areas where differences are evident in a way to highlight where we may focus our efforts in the future in terms of exploring the views and experiences of LGBTI plus mental health service users. For most survey items, and remember that were over 60 nearly 60 items on the surveys themselves. For most survey items, there was little difference between the groups, which isn't surprising. If there was across the board differences on every single item, that would be very, very unusual. However, where there are significant differences, or where significant differences were evident, the overall trend was that LGBTI plus participants reported less satisfactory experiences. Now, of course, there are some exceptions there, but that is the overall trend. As I said, the project is ongoing, so it's difficult to draw any definitive conclusions without additional data. For that reason, Mental Health Reform, in partnership with LGBT Ireland, are carrying out a series of focus groups with mental health service users from the LGBTI plus community. I'm going to do a bit of a shameless sales pitch here for this. But as I said, we would really appreciate if attendees brought this project to the attention of their networks. And if there is anybody who are members of the LGBTI plus community over the age of 18 with experience of accessing mental health services in Ireland in the last few years, and you want to share your story, please do get in touch. You can get more information about the project from mentalhealthreform.ie/My Voice Matters. Now, this project will help our work and the work of LGBT Ireland in terms of advocating for improved services, LGBTI sensitive mental health services, and to help us ensure that mental health services and supports that are available appropriately meet the needs of the LGBTI plus community. So I hope you agree with me when I say we think this could be a very important piece of work. That's it for me. Thank you very much.
Great, Paddy. Thank you very much for that great presentation and for really sharing with us your preliminary findings. And we'll definitely watch the space. And I think it's just lovely to see an organization like Mental Health Reform, which is, you know, kind of outside of the LGBTQI plus community, really taking this on board and doing this research, because normally a lot of the research tends to be done by exclusively LGBTQ plus organizations. So it's just great to see that there's mainstream organizations like Mental Health Reform that are getting involved, because that is sending a very clear message. Because yes, we need, you know, specialized services like belong to like TENI, like LGBT Ireland, but we also need kind of mainstream services to become LGBTQI plus affirming, and because I think in the past it was very much like, oh, we don't do that, you just go to them, you know, you just signpost people to the organization. But this putting a huge pressure on these smaller organizations, where if everybody in Ireland, if every service did their bit, then every LGBTQI plus person could access their local service, as opposed to finding themselves on a bus, you know, coming up to Dublin to access a service. Actually, on that note, I want to share one story. So thank you very much, Paddy, for that. Just one story that I experienced myself when I was when I'm working in Inside Matters. It happened about 8 years ago. I had a 12-year-old ring saying that they wanted to access our supports because they were trans. And I had to tell them, I'm really sorry. They were calling from rural Ireland. I'm really sorry. We can't unfortunately support you because you're a minor, you know. So you need the consent of your guardians or your parents, you know. And I signposted them to TENI, and he said, and they said that they didn't have the support of their parents or their family. And that really broke my heart, because I was like, oh my God, so there's this young person growing up somewhere in Ireland, unsupported, and you know, watching their body change, and in a way that they were obviously not hoping it would. And then 6 years later, so they called when they were 12. 6 years later, I got the call from the same young person saying, I'm on a bus on the way to Dublin now to access your services. And I remember, you know, picking the phone up to this young person when they were 12, and now realizing that they were on their way to Dublin on their 18th birthday to access our support. And I remember thinking the resilience and the courage of this young person, but also the absolute isolation and devastation that this young person was beginning the gender identity journey in Dublin with a service they'd never met before, without any support from their family. And that is, you know, for me, I will never forget this story, because I think the bravery of just humans is just forever takes my breath away. So okay, moving on to our next speaker, Paula Fagan. It really doesn't need any introduction whatsoever. CEO of LGBT Ireland. Where are you, Paula? Are you with us? There you are. You're very welcome, and you're going
Morning, Dil.
Morning, and you're going to share with us, I suppose, the broader experiences of service access and quality in relation to our wonderful community. Thank you, Paula.
Thank you, Dil, and thanks everyone for your patience and sticking with us this morning. I suppose I'm, as Dil said, CEO of LGBT Ireland, and firstly, I'd like to say a massive thank you to Mental Health Reform It's been lovely working with the organisation. As Jill said, it's so important that, I suppose, other organisations outside the LGBTI space become really active on this issue, and I think mental health reform are really leading the way on that. So firstly, thanks to Yvonne and the team for putting together what's a fantastic seminar this morning, and also to Paddy as well and his team around progressing. Now we're going to look at progressing the research into what is the experiences and what are the differences for LGBTI people when they access mental health services. So I suppose, as being closely involved in this seminar, I'm the family hold back approach. I've been asked we have to make up some time. So I'm going to, in some ways, shorten my presentation, but really, I suppose so much of what I was going to say has been covered already. So I'm going to focus in really on what people tell us in LGBT Ireland in our frontline services, and also respond to really why people, given that we are as a community at a higher risk of mental health issues, for all the reasons that have already been talked about, why we aren't accessing services in large numbers, and what are those barriers that are preventing us from accessing services. So I'll try and share my screen, but I don't have many slides, so fear not, because I'm sure you're all worn out with slides this morning. So I think people can see that, hopefully. Tom will come in if I can't. So I suppose, and now I can't get it to move on, but never mind, I can speak to it anyway. Oh, I can, great. So I suppose firstly to say what LGBT Ireland, who we are and what we do. So LGBT Ireland, we're a national charity that works, we provide frontline services. We also deliver a lot of LGBT awareness training and education programs. And then we also advocate for legislative and policy change to try and, I suppose, more longer term and systematically change some of the issues and challenges that people face, LGBTI plus people face across the country. So I think some of the services we do are being spoken about already this morning. We provide LGBT.ie, our website is a gateway really for support and information. And we get about over 170,000 visitors to the website annually. Also, I suppose a fundamental part of what we do is we run the National LGBT Helpline, and the helpline's actually 10 years old this week. So I suppose that gives us a huge amount of experience really of what are the issues on the ground for LGBTI plus people all across Ireland. We also run an online chat support service for people who are, I suppose, that tends to be accessed by younger people. And we more recently opened the transgender family support line, which is a specialised support for people with, for family members with a transgender or trans or non-binary loved one. And then I suppose over the past 5 years, to respond to the more ongoing and longer term issues that some people, more complex issues that some people present through our helpline, we also have set up and deliver peer-to-peer support groups. And they're primarily around support for people who are coming out, but we also run specialist support groups as well. And one of those is specifically around for LGBTI people who are seeking asylum here and are living in direct provision. And then, as Sean spoke about, we recently, as a response to COVID, we set up an Older and Bolder online community group, and that provides, I suppose, a range of events and wellbeing activities each week. So my colleague Colette is actually on a panel later on, so I won't go too much into the training and education that we provide. But I suppose to say that we train about 1,500 professionals each year, primarily in the health and social care space. And I suppose we do run a specialist program, the LGBT Champions program, specifically for professionals working with older people. And I think that program is very important for some of the issues that Sean actually spoke about earlier. I suppose just in terms of our advocacy work, I think Agnes put it so well this morning, we're not a homogenous group. The LGBTI community is a very diverse group of people, and I suppose we can see certainly through our helpline and our services that anyone who's facing additional marginalisation, additional discrimination are really, I suppose, the ones that are suffering the worst. And you'll see that just later on when I share some research we just did around COVID. We also then, I suppose, our primary, we had to, obviously there's a lot of work still to do, and much advancements have been made. So we focus our advocacy work really on those, the communities that we see as more marginalised. And we do a lot of work with older LGBTI people, with people who are seeking asylum here, and also with the traveller and Roma communities. We've done a lot of recent work in terms of LGBTI family rights, and then also, as Meninia mentioned as well, a huge issue for the community is hate crime and the ongoing, I suppose, harassment and abuse that our community do suffer. So that's a huge issue for us as well. So I suppose now I'll just move on to what comes up in our frontline services, and this is our graph really from last year, from 2019. And the red bars represent what people, the top reasons why people contacted us on the helpline. And the yellow bars are really about what the top issues people contacted us on the online chat support service. And the reason why the two are shown is because I suppose the people that contact us on the helpline tend to be, I'll say middle age, I'm not sure what middle age is, but probably in their 30s and upwards. And the biggest cohort of people that contact us on the helpline are in their late 30s, 40s and 50s up to early 60s. For people who contact us on the online chat, it is much younger. The majority, 70% of people would be under 25. So you'll see there that the number one reason why people contact us still is, excuse me, is support around coming out with their sexual orientation. So that's still the biggest issue for people who contact us, both young and older people. Then the second reason, depending on your age, really, that for people who are contacting the helpline, the second reason they're contacting us is around support of their gender identity or gender expression. For younger people, the second top reason why they contact us is really around relationship problems, and that's primarily around family relationship issues. So you'll see there, that's the third issue as well for people who call the helpline. And then the fourth reason why people contact us, and this is very important around mental health services, is people are looking for information around other services that they need. And you'll see further down the graph there, signposting is also one of the top 5 reasons why people contact us. And the biggest signposting area and information area that we get contacts about is really for LGBTI inclusive, primarily psychotherapy. So that would be absolutely number one top issue, top, I suppose, service and signpost that people contact us for. And then you'll see there, isolation and loneliness is also one of the reasons, one of the top reasons why people contact us, and health issues as well, and violence, thankfully further down, but still is a massive issue for people. I will say though, from my experience of working on the helpline, from being involved in our peer support groups, mental health really permeates every single one of those issues that are outlined there in that bar, those bars. And I suppose the interesting thing about it is that people will talk about mental health, they'll talk about anxiety and stress and even suicidal thoughts and suicide attempts. They will talk about that as part of their history, as part of their story, even though they're ringing us because they want, perhaps they need to talk about a current relationship issue, or they maybe think getting close to coming out. Still, mental health, I suppose, and what they've lived through and I suppose experienced, I suppose that permeates everything. So I would say that that's, and I think the previous speakers did speak to that so well. It's not the fact that we are LGBTI that gives us mental health problems. It's the stigma and the shame and the worry that we experience that is so constant, certainly through the people that seek support from our services. So I suppose I'm not going to go into this in detail because I couldn't ever try and do any justice to what Professor Agnes Higgins has done, but I do think it's important I do want to just speak about the two studies that Agnes talked about earlier on. So the Visible Lives on the one hand gives us a snapshot of what the issues are for older LGBTI people, and that was people who are 55 years and older. And I think this just sums it up in some ways. And I think for anyone that's on here this morning that's working in healthcare, it's very important, I suppose, to look at it in this frame. And that is that, I suppose, on the one hand, older LGBTI people, they will have structurally diminished support networks. So as Sean spoke so well in this morning about his own personal experience, unfortunately, he lost his partner very young. But statistically, older LGBTI people are more likely to be single. So 43% of gay and bi men compared to 15% of heterosexual men. We're also more likely to live alone as we age. So 46% of LGBT people live alone compared to 29% of heterosexual people. And we are less likely to have children. So only 25% of gay and bi men and 50% of lesbian and bi women had children compared to 90% of our heterosexual men and women. And I think as well as Sean really articulated, we're also more likely not to see our biological family. And that came through in the Visible Lives study. You know, we're less than 25% of us see our families on a regular basis compared to over 50% of heterosexual people. So when you think about that as we age, that's a whole pillar of support that isn't necessarily available to us. And then when you add in that we have notable differences in health risk behaviours, so I think we've already spoken about in terms of addiction and you know, we're more likely to drink excessively, we're more likely to take drugs, and that came through in the Visible Lives survey of people over 55. And I think as well, I don't need to recap on that, but I think it's been shown this morning, we are more likely to have a history of mental health issues. So that sets the scene, I suppose. And I think Meninia and Agnes already spoke about this, but then when you look at young people, again, you see that much more severe levels of stress, anxiety, and depression. So I suppose we should be accessing mental health services. 33% of people in the Visible Lives study said they had a mental health problem at some point in their lives. 1 in 10 were currently prescribed medication, and 5% had self-harmed in the previous 12 months. So 5% of older people in that study had self-harmed that year, but only 2% of people were accessing mental health services. And I just want to quickly, because you couldn't have a seminar in these times and not mention COVID, but I think it's very important from a mental health context to understand the additional, I suppose, impact that restrictions have on our community. So we recently did a Life in Lockdown survey. We copied Belong To's framework, if you like, and we interviewed adults around their experiences of restrictions, what it was like for them. We had 1,855 valid responses. And I suppose what came out of the study really is that we're, as a community, I suppose lockdown is tougher on us in terms of our mental health. So 62% of us reported a decline in our mental health, and that's comparable to 51% of the general population in other studies that have been done around COVID restrictions. You'll again see in that research survey, which we're going to publish this week, again, those intersectional issues come really to the fore, with people who are in the traveller and Roma communities reporting 85% decline in their mental health over lockdown. And for people who are seeking asylum and live in direct provision, that's up to 90% of people. So while I think some of us have experienced there's benefits to lockdown in some ways in terms of family life and lack of travel and all that kind of thing, for people in difficult situations, in difficult environments, it's absolutely extraordinarily difficult, and people are really suffering as a result. So I suppose I wanted to really focus in on the two studies that Agnes Higgins was involved in, which is our best research to date in terms of the barriers to accessing mental health services from an LGBTI perspective. I think it's important to note that many people have actually experienced discrimination, and I think that comes up in our helpline. Certainly when people phone us to look for a recommendation of an LGBTI inclusive therapist, they tend to have had a bad experience, and they say, I'm not going to go back to that person. They were very judgmental of me, or they thought that my LGBT identity was the problem. And so they're really ringing us to find out, well, who can I be referred to? Who is LGBTI affirming and who is LGBTI inclusive? And I think Sean spoke about it earlier, and Dil as well, that I suppose what people are looking for really is a non-judgmental and knowledgeable person who will affirm their identity and then help them to deal with what they need to deal with. And I think this quote, which I pulled from the Visible Lives study, really resonates with that. So even if the health service is not homophobic, I would think a very large percentage of workers, are not particularly well informed or intuitive around gay aging people's needs and rights. So there's that perceived, even if you haven't experienced discrimination, there's also a perception that the services will discriminate or won't be inclusive or meet your needs. So that's a very important barrier that people have in their minds before they reach out for help. And then I think this is from the LGBT Ireland study. 29% of LGBTI people, so almost 30%, said that they didn't access, or the barriers to accessing mental health services where their LGBTI identity was invalidated, or it was seen as the cause or the symptom of their mental distress. So I think, as we've spoken about this morning, I think obviously we are as a community more at risk of mental health problems, but it isn't because of our identities, it is because of the stigma that still prevails. So that's a really important message for anyone out there who's a mental health professional, for that to sink in. I think, again, you see the intersectional pieces here with the bi and trans people reporting much higher levels of either actual or feared discrimination and stigma as the main reason why they wouldn't access mental health support. And I think what we see as well is that when people do actually access mental health support, they conceal their LGBT identity because they don't want to be stigmatized. So that's very, very worrying finding, because then they can't really access the support in a meaningful way. And then I suppose finally, just on the LGBTI Ireland report, the younger the participant was, the more likely they were to report knowing someone that had a bad experience of mental health services. So again, when that's in the ether, young people talk, we all talk, and young people in particular hear from each other what's working, what's not, and it will really deter them from reaching out for help. So I suppose just this is taken from the LGBT Ireland report. I think it's well worth reading the full report if you are a mental health professional, and go to the section on mental health services and barriers to access. And I think the top reason why people didn't access mental health supports was common to the general population, and that they felt private services were too expensive. That was a deterrent. But after that, then everything really was about the specific issues, the specific concerns they had as LGBTI identified people. So being afraid of the stigma, being afraid that services wouldn't be LGBTI friendly, and thinking that the services couldn't help them, were some of the top reasons why people didn't reach out for help. So I suppose just to move on really to what mental health services can do, and I suppose this is going to be covered in a session towards the end of this morning, but I think the good news is that it isn't expensive, and it isn't, in some ways, it's not that hard to make an absolutely massive transformative difference to people, to LGBTI people and their mental health. And that's the good news, because I'm going to share a video with you shortly of a older man who speaks about his experience of inpatient psychiatric care and the difference that affirmation of his identity made to his life. So that's really important. I think if you go away with nothing else today, I think it's important that you can make a difference with a very small change. And we would see, as our motto in LGBT Ireland is that really the service needs to come out as LGBTI inclusive, so the person themselves doesn't have to. So how do you do that? Well, you get trained like you're doing today, and you build your awareness, and you build your knowledge and your information base. And you make sure you have it. Look, I suppose you scan your service and you scan your practice, and you see, are you using inclusive language and images and posters and information? And I think I would say, if you only do one thing, I'd say if you change your language and really pick your words with tweezers and make your language inclusive, that is the most important thing to do. And I suppose consider your policies. If you're in a large organization in particular, is there anything that you can do to make sure that your service and your practice is visibly inclusive, so that LGBTI patients and clients, that hurdle, that barrier is reduced for them. They do not have to worry about coming out to you. They'll know before they say anything that the service is inclusive. So I think just before I get Tom to roll it there in terms of the video, I just wanted, when I was getting ready for today, I was reflecting on my own mental health issues. And I suppose I had very bad panic attacks when I was young, in my 20s. And my GP encouraged me to go to a psychotherapist. So I did that, thankfully. And, the first session, I spent half of the session interrogating the psychotherapist around how securely she kept her records. And once she convinced me, I suppose, of that they were top secret, I eventually came out to her in that first session. And that was the first time I'd ever told anyone that I was gay. Here I go again. I'm well over that by now, not. And I suppose the difference that made to me, the interesting thing was I didn't mention it again for 6 months because I had other issues to deal with. But I suppose the difference was that I could, if I hadn't done that at the first session, I wouldn't have engaged meaningfully in the mental health, in the support. And I suppose that was certainly transformed my life. And I think you'll see now in the video from Eddie the difference it made to him. So listen, thank you so much. It's been a pleasure, and thanks for listening.
Beautiful. And actually, that reminds me, I used to work for Outhouse a number of years ago, nearly at least 10 years ago, as a community worker before Inside Matters. And that was really the catalyst for setting up the practice. And now, interestingly, we're right next door to Outhouse. So it feels like it's a full circle moment. But I remember when I was working there, there was I got a call from the hospice from a social worker saying that they had an elderly man, an 80-year-old man, who wanted to come out. And as a community worker, I was like, yeah, I'm happy to facilitate that. I mean, I'm sure Outhouse still have that. It's like a tea and cakes afternoon kind of meetup for older gay men. And we said, look, this would be perfect for him to come in. And I still remember the day he arrived to the front door of Outhouse with the social worker, and as a beautifully dressed man, he was wearing his fabulous suit. And as he stepped over the threshold of the Outhouse door, he looked at his foot, then he looked over at the social worker, and then he looked at me, and he said, I've been waiting my whole life to do that. That just sets me off. He was 80 years old when he did that. And that's the reality, that I think a lot of people don't, there's a lot of focus on young people as mental health, and of course we must do that, but we mustn't forget that there's the older members of the LGBTQ community who some didn't manage to come out and are only just trying to grapple with that. And the services, as Eddie said, something as simple as just a little rainbow flag or just a little touch to show that it's an inclusive LGBTQ affirming space. In our center, our actual mat, when you to wipe your feet before you come into the center, is a rainbow mat, and it has the word pride on it. So yeah, so that's just a little touch to reassure people. Okay, so we're gonna have a quick Q&A. If I can ask Paula and Paddy to switch on their videos. You're very welcome back. Paddy, are you there? Paddy?
Yep.
Paddy.
Up there, yeah.
There you are. Okay, we can hear you. We can hear you.
I'm sorry again, folks. My camera is on. I just, for some reason, it's not showing.
All right, that's okay. We'll just imagine your dashing good looks. Okay. So we have some questions for you, Paddy. Actually, there's about a number of therapists from Inside Matters joining us today, and Jim Hutton. A shout out to Jim Hutton and Aoife Ryan and Claudia McGrath. Thank you for joining us. So Jim actually has a question for you, Paddy. When is it anticipated that the full findings of the research will be published?
Right. Well, if this year has taught me anything, trying to predict the future is very difficult, particularly around timelines. So what I will say is that everything going well, and that is without a hitch, we expect to publish at the end of February. However, my experience that things going without a hitch are quite rare. So I'm going to cover myself and say we will have it published by the end of March.
So you're sounding dangerously like a politician there.
Part of the job, I'm afraid.
All right, that's great. So another question here from Dan from Cavan, CAMS in Cavan. Is it possible for adolescents to be involved in the My Voice Matters project and focus groups?
Great question, and something that we discussed in detail in the team. Unfortunately, for this round, it's not going to be possible, partly because the data collected as part of the My Voice Matters project was collected from people that were over the age of 18 who had accessed mental health services. And we had to stick with that conclusion, or that inclusion criteria, in order to be able to compare the findings from the focus group with the findings from the My Voice Matters data. What I would say is that mental health reform are very open to examining the experiences of young people and adolescents, their experiences of CAMS going forward, and it's something that we would be very open to doing in the future. But unfortunately, for now, for this part of the project, it's not going to be possible.
Okay, great. Thanks very much for letting us know. Because it's definitely something that needs to be looked at in the future projects. So let's start with this one, get this one done anyway, and then move on to the next. Then we have a comment from Gwen Kennedy. Also, in terms of people who also live with chronic health conditions, physical or mental health, who experience isolation. Ironically, we have become less isolated due to the world going online due to COVID. Hopefully, post-COVID, when the world goes back to offline and in person, organizations will keep some online elements so that people who struggle can't get there physically still have ways of engaging to avoid isolation. I suppose I wanted to check in with you, Paula. Like in many ways, this whole thing has blown the doors off many services. Is that the case with LGBT Ireland?
Oh, absolutely, Dil. Yeah, and I think that's a good point. What we're seeing is we're having more people come along, particularly to our online peer support groups. So the online definitely helps with the barriers to access, but I think the downside is not everyone is as comfortable in online, as you know yourself. So I think on the one hand, it means more people can get to us. On the downside is I don't think they get as much from the groups necessarily. Not everyone gets as much from the groups when they're online. So what we're going to do hopefully after COVID, is to have a blended approach. So we'll retain some of the groups online, and then the more specialist support we will go back to in person.
Yeah, because even the professional psychotherapy, there would have been many psychotherapists who would have turned their noses up at online therapy and thought, oh no, it doesn't work, it's not really therapy. But it's really interesting that these lockdowns have really made many completely change their mind, because some support, and this is, I think, with the case of LGBT Ireland, some support is better than nothing, because a lot of people might not be able to get on a bus or drive up, or at least they can get some support by logging online.
Can I do a shameless plug? I'm going to
borrow Go for it.
So I think what we are seeing, yes, that's absolutely true. But I suppose given that often people are not out, so they are trying to come out, or they're trying to access support in very difficult environments. So I think that has to be considered. So for example, we've had to, I'm delighted to do so, to buy phones for people who are living in direct provision because they've no access to online means. So yeah, so I think just to bear that in mind, we're launching a fundraising drive. That's the shameless plug. We're launching a fundraising drive today just to help us to respond in that way, because there's some very practical barriers, I suppose, unfortunately, for people to accessing even the support that is there. So I just wanted to say that.
Great stuff. And there's one question for you, Paula, in relation to your study. Helen Montimer says, lovely to see you, Paula. Is your research available now?
Yeah, it will be available by the end of this week. I think Saturday it is being launched, and we're launching it. It's a collaboration with NXF and GCN. So they'll be launching it this Saturday.
Great stuff.
Thanks, Ellen.
So everybody, I'm sure you'll join me in saying huge thank you to our panelists, Pádraig Ó Féich, am I right? Dr. Pádraig Ó Féich, I beg your pardon, who we can't see, but he is there, and Paula Fagan, CEO of LGBT Ireland, for joining us this morning, and of course, Eddie.